This is about the third or fourth time the three of us have had the opportunity to work together, and it's been really great. We appreciate the Wichita Business Journal bringing us together originally. One of the things that's a little unique about our presentation today is the PowerPoint presentation we're able to put up on the screens, and so pretty excited about that. The only thing is, now you know what we're going to say, and so we have to add to that. Kind of curious, I want to ask a couple of questions to get a feel for the attendance that we have today. How many of you in the room would say that you are one of two categories, either HR professionals, administrators, managers, where HR is your daily function, it consumes your time, and then how many other people it looked like on the attendance list? There were many, maybe CFOs, controllers, business owners, general managers, where HR is not your primary function. So kind of by show of hands, who would be in the first category where HR is your primary function? Okay. How many of you then would fall into the other category? And how many of you, it's so early in the morning, you don't have a clue what I'm talking about already? Okay, one or two honest people. Good, good. Okay, one of the things that we're going to talk about today as we go throughout the presentation is there are many things in this bill that depend based on the size of the organization. I don't want to say the company because it applies to more than just companies, it also applies to nonprofits. So I want to say the organization. Some of those critical points are when an organization hits 25 employees. If you're under that, there are some certain incentives you can take advantage of. Another key point is the 50 employee mark, that if you're over that, there are going to be some requirements that you're going to be subject to that the smaller companies won't be. And then by the time you hit 200 employees or more, there are again a couple of additional requirements that are going to apply to organizations that size. So kind of by show of hands, how many people would say you're from an organization of less than 25 employees? Okay, so we have a number of you. I'm going to spend a little bit of time a little bit later talking about some of those incentives. How many of you would say you're from an organization greater than 50? Okay, most of you. How many greater than 200? Okay, again, quite a few. All right, well, we're gonna try and spend a lot of, or more of our time then probably focused on the larger, but certainly the smaller organizations. Don't want you to feel like this doesn't apply to you, because it does, and we'll touch on that too. In a really big picture, we've given you some information here, those first couple of paragraphs about how did these bills come to be. There was a lot of misunderstanding maybe that happened because last fall the House passed a bill, and then the Senate passed its bill in January, and then they got reconciled in March. And so we kind of have, we have at least two, and to some degree three different versions of healthcare reform, and they each got a lot of press. And so we have people ask us, and Karen and Terry, I'm sure you have too, people ask you questions where you're like, well, yeah, that was in the original bill, but it didn't make it through reconciliation. So hopefully today we're going to bring some clarity to that. In the really grand scheme of things, though, in the broad overview, this bill is about a $940 billion bill, and that's a lot of zeros and commas. But that's not uncommon with our government, except when you think about, I look back at in 1965, the federal government enacted Social Security. Social Security came into existence then, and they projected out 25 years and said in the year 1990, they estimated that Social Security would cost our country about $13 billion. The reality is in 1990, Social Security cost about 90, and I can't remember if it was 95 or 98. All I know is it was in the mid to upper 90s billion dollars. They missed it by a factor of almost 8. So I don't want to strike panic in everyone, but if you think about $940 billion, and I hope we've gotten better at estimating and budgeting, if not, that number could be substantially larger, just due to many factors. But of the $940 billion in the next 10 years, about half of that is going to be offset with new taxes. And by taxes, we're also going to include penalties in that number. We'll talk about some penalties later on. The other $500 billion is anticipated to be offset by decreases in healthcare spending, primarily by Medicare. If everybody would kind of stand up, I want to illustrate something. Go ahead and stand up. What I really want to do is give you the opportunity to move your chair if you figured out you were right behind somebody. But if this room represented the United States, 360 million people roughly, Prior to the enactment of this bill, 54 million Americans did not have access to what's known as affordable health insurance. And so if everybody except this middle column would go ahead and sit down, our middle column will stay standing. The middle column now represents approximately the number of people that did not have access to affordable health insurance prior to the bill. If the first two tables would sit down, okay, our last table now still represents as a population of the room, the percentage of Americans that don't have access to affordable health care, even after this reform. You guys can go ahead and sit down. Thank you. I didn't see anybody move their chairs, so I'm assuming everybody has a good look, but or a good view. But what it does is it still shows that there's a certain percentage of the population that doesn't have access to affordable health insurance. Again, that's a rather loosely defined term, affordable health insurance. But with that, let's go ahead and get into, before we get into the bill, there are a couple of concepts that are not unique to healthcare, but what they do is they really permeate this healthcare reform. And they get defined differently. In this bill, they use the same word, but they define it in different ways several times. And so one of them, and I don't want to spend a ton of time on this, but one of them is this concept of who is an employee. That ought to be pretty simple, you know, and I think for many of our maybe larger organizations, that is somewhat simple. I mean, they know who's an employee, they know who's a contractor, but for many of our mid-sized companies or small companies, small organizations, this line gets a lot less clear, shall we say, because we start to enter into agreements with people who are maybe not employees, they're independent contractors, but yet they, according to the government's definition, they may be employees. And so what we've provided here is just, these are some factors that the IRS uses, not that the IRS governs on this healthcare bill, but it's something that, it's a documented way that at least one government agency says, here's what we're going to look at when we talk about employees. And so what it really boils down to is how much control or how much influence does an employer or the person, I guess, doing the contract, the person doing the paying, never mind, I was about to get sidetracked. The person, the employer, how much control or influence do they have over that contractor? If they exert a lot of control, if they determine when the person works, how the person does the work, if they provide the work environment, if they provide the tools, all of those start to become factors that they're really employees. And again, based on that question earlier of are you under 25, are you over 50 employees, are you over 200, this concept of who's an employee starts to become more and more important, because if you're under, there are some incentives. If you're over certain numbers, there are some penalties. And so it's something to be aware of, something to be cognizant of. Well, we also put in some information here. I'm not sure very many people know that this actually passed a few years ago, but a few years ago the Department of Treasury and the IRS, they came out with new regulations, a new process that allows someone who thinks they should be an employee to basically turn in their contractor boss / employer and say, I really should have been an employee. It's a process for that. Don't want to strike panic in the room. It's a little more difficult than how I described it just then, but that is there.